This is something that's been happening all my life, and I would have hoped that people would be able to understand. And when I did think I could confide in my friends, they decided to use it against me. So it's just been difficult. It's almost as though no one understands. So yeah.
When our health falters, the impact can be dramatic.
What is it? Tell me.
I just hate it so much.
But often, it's our partners and our loved ones that suffer just as much.
It's almost like having a third person in the relationship.
How could you want to look at that and be attracted to it?
Are you here alone?
Yeah, by myself, really.
With top in-house specialists on hand to treat his patients.
Lean back towards me.
Okay.
Good morning. How are you?
World-renowned Dr. Christian Jessen has set up a state-of-the-art clinic to give people from across Britain the kind of care that sometimes fails to reach them.
Nice to see you.
I'm just hoping Dr. Christian can make my life happier.
Oh, that's why I love my job. It looks to others like you love yourself.
Yes.
And actually, it's probably the opposite.
Massively. I'm really sorry.
It's okay.
I'm so sorry.
Every step of their journey will be captured as they share their most vulnerable moments and intimate problems, in the hope of solving issues at the very heart of their lives.
I've got that one at the front there.
Every day I think about it. Something has to be done.
I'm scared I'm gonna die.
I'll have the opportunity to talk to partners, to mothers, to daughters, as well as the patient themselves, really to try and pick up all the pieces and to address the sometimes very complex emotional problems that come hand in hand with the underlying condition.
I finally have answers. It's amazing, absolutely amazing.
There's actually hope.
My cake exploded in the oven. I don't know why I put in a cake.
Well, actually, I met someone last night.
Did you?
I did. It's a really nice chap.
Hello.
Hi, morning.
Morning. How are you all?
Good, how are you?
I'm all right. You look very fresh and happy.
I say you're looking really well.
Oh, I have a very good surgeon here.
Hook me up, boy.
How are your evenings?
Wow.
Oh, that was interesting. Come on, dish it.
I went out for some drinks last night with an old school friend of mine in the centre of London. And yes, I met this really lovely guy. Yeah.
Really?
Exchanged numbers, so yes.
I'm happy.
I'm really excited, actually.
That's the sort of news I want in the morning. That's the sort of thing.
I'm going to be smiling all day today now.
Good. Let's do it.
Have a good day, guys.
You too. See you soon. Bye.
Bye.
Hello. Come in, please. Thank you.
Hi.
Hello. How are you both?
Yeah,
Good, thank you.
Please sign in for me here.
Thanks.
Thank you. Take a seat.
Theresa Hinton. I'm 32 and I'm living near Swindon.
Are you both okay?
Yeah.
Yeah? Where are you coming from?
From Wiltshire.
That's a bit far away.
Yeah, it is, yeah.
Do you live together?
Yeah.
You married?
Yeah.
Oh, how long now?
About 4 years, I think.
That's pretty new.
Met at work, chatted him up.
Okay, you're a brave lady. I'm too scared to chat men up.
Yeah, messaged him, said if we wanted to go for a drink or something, and he put me off for a year. So eventually he said, oh, I'll go for that drink if you want. And I was like, don't know if I want to anymore. So I gave him the chance anyway, and yeah, we ended up going out and eventually got married.
Have you got any children?
Yeah, we've got two children.
How old are they?
5 and he'll be 2 in April.
Oh, they're really young.
Yeah.
Boys or girls or both?
One of each, yeah.
You're lucky to have both.
Yeah, I know, yeah, it's nice. We're an active couple, you know, and seeing friends and going out and stuff, and regardless of having children, you know, now that seems, you know, quite difficult because of Theresa's condition, even going out to the park. Okay.
Theresa, Dr. Christian will see you now.
Really, I just want my wife back. I want my wife and my family back, because at the moment we're just managing her symptoms day to day.
And it's had a massive impact on your relationship?
Yeah, it has, yeah. Yeah, it's rocked it to the foundations.
Come in. Hi, Theresa, how are you?
Yeah, it's bad, thanks.
Come along in and have a seat for me. Nice to meet you.
Nice to
Hey.
meet you.
So, how can I help?
Basically, I've had quite bad health problems since the birth of my second child. I've had severe varicose veins down pretty much the majority of my leg, but they were treated.
How were they treated first time?
They were pulled out, so phlebectomy.
Okay, yeah.
And I also had pelvic vein embolisation prior to that.
So the varicose veins were extending up and you had some distension up in the...
So basically the scans, internal scans had showed that I had varicose veins in the pelvis, which were leading to the veins in my legs collapsing due to the blood pooling. And they've diagnosed me with pelvic congestion syndrome.
Pelvic congestion syndrome is a condition which affects women where the blood vessels in the pelvis become distended, like varicose veins, and these can cause a lot of pain and a lot of discomfort. We can treat it with a process called embolisation, which essentially blocks off those blood vessels, but unfortunately it isn't guaranteed to work for everybody.
My symptoms have got worse since having this embolisation. The veins in my legs, really came back about 10 times worse.
Whereabouts is the worst pain?
It's just there, sort of.
More so than the leg pains?
I'd say so, yeah, just unbearable.
And what do you do to try and sort of relieve it yourself? Is there anything that helps a little bit?
Putting my feet up. It's obviously difficult to children. It's literally the only thing that helps, apart from taking painkillers, but that doesn't take the heavy pressure away as such. Prior to all this, I was really active, walked, cycled.
Yeah.
Now, you know, I feel I'm debilitated most days.
Hi, my name's Barry David May. I'm 31 years old and I'm from London, Islington. Hi.
Hello, hi guys. How are you both?
Good.
Good. Can I have your surname, please?
May, M-A-Y.
Sign in for me here.
I like to think I'm bubbly, outgoing, a workaholic, always working. I'm very positive. I don't get upset with anything. You put me in the worst scenario and I will still make you laugh about it because that's just me.
You right, guys?
Yeah.
Yeah. Are you brothers?
Yes.
No way.
Yeah, so she got it right.
What do people mostly think that you are?
He's my son. Am I really am I aging that bad?
What's your age difference?
You're 21, are you?
2.
22. 9 years.
You don't look old.
I like you now.
I definitely think we need to have a better look. You know, one of the things that happens with varicose veins is you treat them, stop the blood flowing through one area, it sort of finds another way. It's like when you build a little dam across a stream, it works its way around.
I just feel I've done more damage than good having this embolisation. But
Let's get you to a gynecologist who knows about this sort of thing.
okay.
How does your husband cope with it?
He struggles though, you know, he's frustrated that I'm obviously getting worse. I think it's more the fact that he can't help me as such. Seeing me in pain, feeling helpless. We've done so much, you know, we've gone to so many appointments.
Is it affecting things between you?
Yeah, we haven't seemed to be getting on very well. There's a lot of stress between us. He's tired, I'm tired. You know, the stress causes us to argue quite a lot. You know, he's got a full-time job, yet he's having to do a lot more around the house, and deal with me not being well and moaning and, yeah.
But he's dealing with it sort of okay, is he? Or do you think he's crumbling a bit?
He's crumbling, yeah. And it escalates into full-blown arguments, you know, and the point that we're going to leave each other. But
You've talked about that.
yeah, we both know it's down to me not getting better.
You're saying that like it's your fault, though. But...
I know. I do feel like I'm a burden.
Yeah. Why, though? It's nothing you've done, is it?
No. Sorry.
It's okay.
I just feel like I'm not getting better. He's going to refer me to a gynae. He thinks it might be that veins have taken its toll.
Yeah, that's what we thought, wasn't it? But nothing, no revelations. No.
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 Hello, all. Barry.
Yes.
Do you want to come on through?
Yes. So I was at around, I think between sort of 13 and 15, I started getting placky skin on my elbows and on my knees. It was around the same point when my mother and my father split up. It was quite a brutal separation for them. Had there not have been that scenario, that could have been the trigger point.
That's a very nice shirt. I approve of that. I like a loud stripy shirt myself, but how are you, Barry?
Good, good.
What can I do for you?
I've got severe psoriasis. I've never been given the correct advice of what I need to do. And the best advice I was given from my GP was to not get stressed out. And to me, that's kind of useless advice because part of the condition stresses me out.
Yeah, I understand that. All right. Tell me a little bit more about the skin problem then. So how long have you had it?
I've had it since about 13. I'm 31 now, so I've had it for a fair while. I've always treated it with creams and stuff, and I've never actually found a cream that actually settled it down.
I think let's have a look. Yeah. A, make sure it absolutely is psoriasis, because if it isn't, that would explain why treatments aren't been very effective. And let's see how extensive it is as well. I think just take your top half off will be the best thing. I'll undo your shirt. Oh, golly me. Yeah, wow. That is, oh, you poor thing, it is all over, isn't it? Yeah, okay. I don't really need to get any closer to see that, do I? Sit yourself down, that's okay. How, sort of on the scale of as bad as it has ever been versus as good as it's ever been, where does this sit on that scale?
In the winter, it's worse. In the summer, it'll back off a bit. It'll still be placky, but it's not as irritating. In the winter, it's absolutely like that now. We're trying to move my arms.
Yeah.
The worst is in the mornings when you wake up. So when I wake up on my back's really stiff.
Yeah.
And my arms, I straighten my arms out. When this cracks, it just bleeds everywhere.
How are your nails?
The nails are quite bad.
Yeah, you've got little pitting in your nails, so that's also the psoriasis. How much does it upset you from a sort of self-esteem point of view?
My self-esteem is pretty low. I try not to let it upset me, but I think the more I speak to people about it, the more I realise how much it does actually affect me and how much it upsets me.
Pop your shirt on or you'll get really cold. So you scratch it?
Constantly.
At night? I mean, imagine, do your sheets look...
Covers are completely covered. You put a new... And you can always guarantee the night I'm putting the cream on, it'll be the night when my missus has changed the bed covers or something, and it's just a nightmare.
Okay. How does she sort of take it and cope with it?
She's caused quite a lot of attention. We've got a material sofa, so I could be watching something on TV, itching my arm, and next thing you know, it's bleeding.
Oh, and you bled on the sofa and she's shouted and...
Yeah.
I see. I think, well, first of all, it's all over the place. It's everywhere. You are not going to be fiddling about on a daily basis, slathering yourself in cream, let's be honest.
Yeah.
And I think any doctor that says you've got to be doing that is not being terribly realistic or practical. I mean, you can't reach half the places you've got to put
that
your
is a
cream,
big issue, yeah. Because that was my attitude as well. And it was like, you have to put the cream on 4 times a day. I'm a heating engineer. And to put cream on 4 times a day, it's just like virtually impossible. So the plaques I've got in the middle of my back, so I just asked my apprentice to put cream on. Do you know what I mean?
I'd like you to see a consultant dermatologist and talk through now the big boys treatments, you know?
Yeah.
They're a little bit fiercer, a little bit more hardcore, systemic treatments, you know, pills or injections or whatever. We can never cure your psoriasis.
I know that, I'm totally aware of that.
We can definitely get it much, much better under control, without a doubt.
Yeah.
All right, look, leave it with me. I'm going to sort out a specialist to see you today.
Thanks
So is that all right?
Cheers.
Okay.
Cheers.
Nice to see you. Bye-bye. Bye-bye.
Bye-bye.
Oh my God.
I'm excited.
Oh my God. I'm a bit nervous.
I don't blame you.
Okay. Oh wait, did I press the right bit? There we go. Typical me. I'm Danielle, I'm 19 and I'm from London.
Please come in. Thank you.
Okay, let's go. Oh my God.
So bright.
It looks really pretty. I would describe myself as an easygoing, bubbly, yet straightforward person. I love having a laugh, but I also value honesty, and I feel like people would get a long way if they're honest.
Are you two best friends?
Yeah. How long? Obviously, we've known each other since year 7, so that was like 2009, so like that's literally so long. We are BFFs. Bays for life. Oh my God, yeah, bays for life.
Yeah.
Bays for life. Bays for life. Normally it's best friends for life, but
Bays. I'm actually so excited to know what they're gonna actually like treat it as.
I know, like I've had this problem for so long, I just want it to get over and done with, see what's wrong, see if it's treatable.
Yes. Okay, cheers.
Come in.
Thank you.
Larry.
Hi.
Dr. Shiraz, nice to
You
meet
all right?
you. Is it okay if I have a look at your skin?
Yeah.
Let's bring you across here. Wow.
Yeah.
It's been affecting you quite a lot, you can see there. Right, okay, do you want to just turn
Living
around?
with psoriasis is terrible. You can't have luxury things in your house because things are constantly getting covered in blood, covered in the skin.
Do you mind standing up? Yeah. And just turn around.
Doesn't matter how much you try and hoover up your skin, there'll always be skin on the floor because whilst you're hoovering up, your skin's actually flaking off every time you move your body.
Does it go on the buttocks as well? You can see why this dominates your life.
It affects everything. Intercourse can be a bit interesting sometimes because I do get psoriasis downstairs as well.
The normal progression for treatment for psoriasis is usually you would normally start off with various creams, which won't really work for you. Light treatment does work for a lot of people, but again, it is requiring you to come into hospital twice a week for up to 2 to 3 months, depending on how you respond. The third option you normally would have would be tablet treatments. However, there are reasons that we can't give them to certain people. So one would be if you had problems with your liver, if you drank excessive alcohol, or if you had issues with, for example, your lungs.
Right.
So I think what we'll have to do is send you off to a chest x-ray for them to assess your lungs. Once we're happy that actually your lungs are okay, then we can move on to proper treatment for your skin.
Okay.
I'm pretty confident that we should be able to get this better with the right treatment. So all these plaques that you see, the red scaly areas on your abdomen, your back, by 60 to 70%, they should get smaller.
Wow.
And that can be life-changing in a lot of people.
It would be.
Good. All right, we're all done. Let's see how we can sort this out for you then.
No problem.
Okay.
Cheers, thanks for your help.
So I've been diagnosed with pelvic congestion syndrome. I had the treatment, the vein embolisation.
Theresa?
Yeah.
Would like to come with me on treatment room 2?
Okay. I was told by the consultants that this would be the best thing for me. However, it's made my symptoms a lot worse. What I'd like would be for me to find an alternative treatment, to see if there are any other problems that haven't been addressed.
So I'm getting the feeling at this stage you're not a fan of embolisation.
No.
Okay.
I regret having it done.
You regret having it done?
It's made everything worse.
Is it all right if we do examine you?
Yeah,
You
yeah,
okay?
it's fine.
Right, so you pop up there.
Yeah.
All right.
We'll start on the side where you've got no pain.
That's fine, yeah.
What's it like at home?
Yeah, a bit manic at the moment with the young kids.
Okay.
Because I do everything in the night and I get up early in the morning to sort them out, so...
Okay. Then you have to go to work.
Yeah.
You must come back so tired.
Yeah, I do, yeah. Yeah, it is, yeah.
We're always arguing because the stress, the tiredness it puts on both of us. Sometimes I think, he doesn't love me anymore, he doesn't want to be with me. I'm just some invalid that he's got to put up with. He says, oh no, that's not true. But at the same time, he doesn't necessarily show that things are good between us.
Okay, that's fine.
Right.
Okay, I'm going to help you. This
Okay.
so.
Right.
So, examining you, that you've got a nice soft abdomen, but you have got, as you said, very localised tenderness, highly localised in that one area. But there's no masses, and I can't feel anything else but just the tenderness. Now, you did have a scan with us as well, didn't you?
Yeah.
And we've got that here, and showed normal uterus and ovaries, and no abnormal ovarian cysts, no varicose veins alongside the uterus, or in the muscle of the uterus. So the conclusion is that this is a normal examination. So that's both reassuring, but
Yeah,
obviously,
I know.
in
Just
some
doesn't give me
regards,
answers.
frustrating for you. So the way forward is probably to take a different tack and say, well, is there another cause of pain? Is there something to do with the pelvic? Is it pelvic in origin? I think probably you need a laparoscopy.
Laparoscopy essentially means having a look inside the abdomen with a small camera, and it can be used for diagnostic reasons to see what's going on, to see what the cause of a pain is, or you can even at the time take samples or do a surgical procedure.
Let's hope that gets sorted out sooner rather than later.
Yeah, it'd be nice.
Okay.
What happened?
He thinks I need a laparoscopy to rule out anything else. He could feel the tenderness.
So we don't know any more than we knew already. Isn't it, really? Hey, no better off.
Have you guys seen them big butts? I call them badonky donkeys. Badonky donkey.
Kim K started that trend, and it is just unattractive.
No, it wasn't Kim K, it was Nicki Minaj who started it.
Oh boy, since that Starships video.
Yeah.
That's super bass.
Yeah.
Yeah.
What do you think about big butts? Do you guys like big butts?
No.
No.
That's stupid. He was frank about it.
He was like, no.
He was like, no. Never.
Can I see Danielle and her friend? They can come in together.
Let's go. See you later, guys.
Okay.
Oh, wow. Oh, my God. It's almost like it's a lifelong condition, something that I suffer from on a day-to-day basis. Some days it's okay, other days it's horrific. Oh, here's his name. I'm actually panicking. And my closer friends, they just understand. They don't make me feel like this alien who, you know, deserves to be on another planet just because of a condition that that I can't treat. I need to breathe.
Okay, look at me.
Okay, let's go.
Come in.
Ooh. Hi.
Hey, how are you?
I'm okay. How are
Danielle,
you?
yeah?
Thank you, yeah.
Ah, nice to meet you.
Nice to meet you.
Come and have a seat in that
Thank
chair there
you.
for me. Who are you?
Hi, I'm Aria, just a
Aria.
friend for sport.
Nice to meet you as well. Aria, straight out of Game of Thrones, right?
Yes.
Popular name at the moment.
Yeah.
What can I do for you, Danielle?
So I've been suffering from a scalp problem that I've had since as long as I can remember. And basically it's like it just flakes, but a lot. So it's like really excessive dandruff.
Yeah.
But it's got nothing to do with dandruff. It gets to the point where it bleeds sometimes and it's just overly itchy and it's just a really frustrating situation.
Has it ever gone away since you've
Never,
had
ever.
it? No.
There are times, so obviously when I first wash my hair, that it sort of dies off, but then it's almost like my scalp just absorbs any oils, any water, and it just goes really, really, really dry. And in like 1 or 2 days, that's it. It's like my scalp's back to this sort of sore, dry, flaky thing. And I just don't really know what to do anymore.
Do you get dry elbows and knees and
My
chins?
face does get dry.
It does?
And I do have to do quite a bit to get my face moisturised.
Yeah. Where is it dry? Which areas?
Always here and just at the beginning of my eyebrows. It gets really, really dry. Also flaky, but it doesn't drop, you know, like I just put cream and it sort of goes away. Yes.
I think the fact that you get it around here, around your eyebrows, is our clue as to what this is, actually. But I'm going to let a specialist tell us that. You have a partner?
Yeah, I do.
Does he know about it, or like so many people do, have you managed to sort of keep it secret?
This is going to sound so weird. Before we started dating, when we were just friends, I gave him a list of things that weren't normal about me.
How romantic, isn't
you know?
it?
Wow,
things that weren't.
Why did you do that?
I think it just got to the point, because I've had a lot of people saying really horrible things regarding different things about me. So I thought, you know what, I like this guy. I'm going to clear the air so he doesn't think I'm weird, although it came across weird. You know what I mean? Exactly.
Yeah. That's interesting, that list thing.
I know.
But also makes me slightly sad, because that suggests you don't have much confidence.
I've sort of, because I was bullied so badly, it got to a point where I realised that I had to be strong. Sorry?
Why were you bullied?
I was bullied for a lot of reasons. Obviously, my scalp being one of them. Bullied for my teeth, bullied for the shape of my nose, bullied for my eyes, bullied for pretty much anything that you can think of. Mentally, I think it has sort of played with me. Because, you know, it's just...
Were you at school together?
Yeah, and...
Were you aware of all this?
Some of it I was, because I know how terrible some people at our school could be. I did know that, like, even before we were friends, I did hear a lot about, like, a lot of things about Danielle.
Yeah,
and I was just thinking, she just seems like a lovely person. Why is this all going on?
How did you deal with that? You know, children who are bullied badly at school can come out of it a wreck, you know, really, and you don't strike me as a wreck at all.
It was hard, and I actually, you don't know this, I developed social anxiety, and ever since my attendance in school was never the same. That's why I was never in school. Sorry. But it did get to the point where I couldn't leave my house, and I just felt low all the time. And I tried to come out of it strong, but it hasn't been an easy road, because obviously, you know, I've been bullied since the age of 5 or 6. So, you know, like a good 10 years of my life, it's been happening. And I did. I suffered
It's okay. I'm sorry to bring it up. I think it's good for you to talk about it.
She's been super strong. I know since sixth form, she's been trying so hard to put on a brave face.
But I did suffer paranoia, because now even when I leave the house with them, I'm so happy I feel like everyone's looking at me because of my scalp. And
But your mental health I'm worried about, not because you're unstable, because I think we could support you a little bit more and help you a little bit more with that, you know. Have a chat with a consultant dermatologist to have a look at your scalp. And also I'll have a think about how best to look after you as a complete package rather than just a scalp, because you're certainly not just a scalp.
I've been out in a long time. Let's go out, clubbing or something. Oh.
When was the last time you went out?
Maybe 5 months ago.
What?
Because I'm busy and got life.
What about on weekend?
Saturday's my lazy day. Then Sunday's my laundry day and go to eat day. That's it.
Okay, yeah, but then you go out Saturday, still do your laundry.
I'm lazy. I'm so lazy. I'm an old lady.
You're not an old lady.
I'm an old lady.
Right, guys, I'm ready to come and see you again. Come on through, Matt and Christian. Yeah. Nice to meet you. Will you come on through? Yeah, both of you can come.
Yeah, okay.
Come along this way. Okay. So, you've seen the gynecologist.
Yeah.
How did it go? What are your thoughts?
He recommends having a laparoscopy.
Yeah.
To rule out any other things.
Definitely. We're covering as many bases as we can to try and give you answers.
Okay.
Do you feel a bit happier that things are moving?
Yeah, but I'm not sure if things are moving. I mean, perhaps I thought that I would potentially get some actual treatment, you know, or...
Are you disappointed?
But yeah, a little bit, yeah.
The tests that you've got lined up are the right things to be doing. I think the most important thing we can do is keep going for your sake.
Yeah, just hope we can get some answers. And it's difficult, isn't it? I mean, it's ruining our marriage, just being like this.
Right, what do you feel?
Yeah, it'd just be nice just to have my wife happy again, because that affects the whole family.
Yeah.
And it affects the whole family every day.
Yes, you can say it all comes down to me, which probably does, because, you know, I should be doing more. And I think perhaps you have some resentment that you're having to do more. And, you know, I think you feel that, you know, I'm always ill when I had the sickness bug. You know, you told me to get out of bed and get on with it, and it wasn't easy.
No, but sometimes you have to rouse yourself, don't you? I know it's difficult.
Yeah, but I couldn't that time.
Sometimes my job is to try and mend relationships as well as heal. I've seen relationships completely fall apart due to an underlying medical condition in one person. A happy patient, a confident patient is going to face an illness far better than a patient who isn't.
Sometimes, you know, I don't think it all is just down to my problems. You know, there's fundamental things in our relationship we need to sort out, which, you know, regardless if I'm ill or...
Do you think you guys could benefit from a little bit of help in that area?
Counselling?
Whatever. I think it would help, I really do, to thrash it out. I don't mean literally, but, you know, talk things through, lay it out. You say what you're not happy with, you say what you're not happy with. But also importantly, say what you are happy with. Actually, acknowledging what is nice and what is good is important, because you get so clouded with the bad stuff, you know? But if you need, you know, a little bit of help to do that, it's no bad thing, it's no weakness, you know?
Yeah, well, it's worth thinking about.
Yeah.
Yeah.
I would love you to stay together and help each other through this. It's not all doom and gloom forevermore. There are ends in sight, you know, there are possible options we can go down, and I'd like you to go down them together.
Yeah.
Okay? All right. Thank you so much for coming. I appreciate it. Come on, if you go back down to reception, they will look after you there. All right.
I'm feeling, you know, slightly optimistic that, you know, the investigative treatments could possibly help me.
Please both sign up for me.
Yeah.
Just over here.
I don't think there's really much more that my husband can do. He does as much as he can. Maybe I shouldn't be so needy, but the way I'm feeling, you know, I need that emotional support. Yeah.
What is the most important thing in life?
My daughter, she will always be the most important thing in my life.
Is she daddy's girl?
Yeah, 100%.
Oh, bless her.
See, nothing else matters to me, nothing more. That is my one thing, but... OK. She's seen it since the day she was born, so to her it's just daddy. If her friends come round, she does get a bit embarrassed if her friends are there.
I want you to put your chin on that.
OK. If I've just got out of the shower and she's playing in her bedroom with her friends and I've walked into my bedroom opposite the shower and she's like, Dad, put a top on. And it's just like, to me, it's just like, well, that's my skin condition. But to her, it's like, I don't want my friends to see your skin condition because they go, oh, look at your dad.
You need to put your hands there.
Some of the medications that we give to patients with psoriasis are very strong and they can have an effect on the immune system.
Okay, breathe in and hold it.
If there's any infection present in that person's body, it can take over and become a real problem. So we always screen patients first with a chest X-ray.
You are finished now.
Smith. Hi, Christian.
How's it going?
So, I requested this chest X-ray on Barry as part of the screening procedures we do for certain medication that we want to give for psoriasis. But I wasn't expecting these results. No, I have it up here.
That's not a normal chest X-ray.
No.
There's possibly a little bit of fluid in the corners, which means some sort of reactive process is going on, either an infection or some sort of inflammatory thing. I'm not coming up with any diagnosis for this.
No.
Are you?
He's 31. He's not a heavy smoker.
Worst case scenario could possibly be a type of growth or tumour, but I can't see it.
But before I can give him any medication,
we need to investigate this.
I don't mind chilling here, yeah. Good lighting.
It's a comfy sofa.
Isn't it?
Isn't it?
Got nice pillows.
Trust me, girl.
Dr. Christian will see you now.
Come in. Hi, Barry. Welcome back. Hi.
How you doing?
How are you? I'm Christian.
I'm Frankie.
Nice to meet you. Have a seat. Have a seat. All right. I've got you back in really because we did an X-ray for you, which wasn't completely normal. And your X-ray showed you to have a little bit, like a bit of scarring, a bit of infection, something. Okay. And also at the bottom of both of your lungs, a little bit of possibly fluid or a bit of thickening. Now, you see those changes in all sorts of different conditions. So the annoying thing is I can't look at your X-ray and go, it is this.
It is that, yeah.
Now, it's interesting with your job, actually. I mean, are you exposed to stuff you breathe in, or is that past, you know?
Flux.
What's that? Oh, soldering flux.
Soldering flux, yeah.
That's interesting. What, from soldering copper pipes?
Copper pipes and dust, a lot of dust.
Yeah. I mean, it's possible it's slightly related to that. It may not be. And I'm not going to play the guessing game. Yeah. We'll organise a CT scan for you as soon as possible, and I think I'm going to get you to see a chest specialist, chest physician as well, to have a look at it and take care of that. Depending on what the results are of that, we'll either go ahead with the treatment of the psoriasis, or we'll wait a bit and sort your chest out and then do the psoriasis treatment. I mean, I'm very, very aware that this is a lot of stuff to take on board. You know, you thought you were just going to get some psoriasis treatment, didn't you?
Yeah.
And now we've gone and given you some complicated condition that we can't even explain or tell you why you've got, that you've got to walk out the door with. So how are you feeling about things?
I feel all right. I think maybe when I think about it more, I might be a bit different.
Take a breath. Don't get yourself worked up.
No.
If you are struggling, come and tell us.
No problem.
All right, Barry?
Excellent.
Like, come on out this way. If you go back.
Today's mixed emotions. No problem. Cheers.
All right, bye-bye.
Thanks a lot. So, yeah, I'm a bit up and down at the minute. I don't know what to think. Life has to go on, doesn't it? That's you know, I could sit there and cry about it and say, you know, I can't do nothing, but I'm a big believer in that, you know, I'll always make the best of a bad situation.
Lovely having you two.
Thanks a lot.
Thanks for having us.
Thank you. Have a good
Cheers.
day.
Take care. See you later. Take care.
See ya.
See ya. Let me just check my face.
You look fine.
Girl, you look fine.
Always good to be reassured. Yeah, I look okay.
Danielle, we're ready for you in treatment room 1.
Okay, thank you. Oh, treatment room 1. Oh, here it is.
Hello.
Hiya.
Come through, Danielle.
Thank you.
Take a seat.
Oh, yeah, sure, thank you.
My name's Dr. Shiraz. Nice to meet you.
Nice to meet you.
Right.
Hi.
I've been told that you have a scalp condition. Do you mind if I have a look?
Yeah, please do.
Let's pop you across here.
Oh, I'll take that. Oh, thanks, girl.
Just take a seat on the end here, and I'm just going to shine this bright light.
Okay.
Right, so
Maybe I
let's
should have bought sunglasses.
pop your head down first of all.
Yeah, sure.
Let's have a look at these areas.
From about 9, probably younger, I've been brutally bullied, including physically, and it just hasn't been nice. People find anything to tease me. My school experience was pretty horrific, and it got to the point where I just didn't want to go to school.
So there is definitely some flaking visible there, and you can see bits falling out.
Oh my God. And although, you know, some people think, oh, it's only your scalp, it's not that bad. It's not only abuse I've suffered from it, but it's pain as well. So, you know. Yeah, it's not as simple as it sounds. Yeah.
The condition you have is called seborrheic dermatitis, but you have a slightly more aggressive form of it. It's caused by yeast that lives on your skin and in fact lives on everybody's skin. And the yeast tends to feed off oily areas in your skin, which include these areas in your scalp. We may not be able to completely cure the yeast, but we can definitely make it better. Okay, so we're going to have to, I guess, use special shampoos, 2 different types of ones I'm going to give you. We should definitely be able to control the number of yeast in your skin, reduce them, reduce the inflammation, reduce the scaling and the redness, and hopefully it should be much more acceptable for you.
Okay.
All right?
Yeah, thank you.
You're welcome.
Do we have to knock? I don't know if we should knock.
Come in.
Okay. Hi.
Welcome back. Hey,
again.
come on in again. Yeah.
Thank you.
Good. So you had I hope a useful chat with the dermatologist, was it?
Yeah, it definitely was.
What did he suggest?
He has given me some shampoos, so yeah, it was amazing.
2 things I really want you to take away from today, all right? The first is, this is going to be an ongoing thing, all right? So you're going to have to keep using treatments now and again, but I hope you're going to find you're able to get it a little bit better under control, all right? The second thing, I think, is to acknowledge that link between state of mind and physical conditions,
Yeah.
you know, which we all know exist, but sometimes that connection isn't always made. There's a really interesting branch of medicine emerging called psychodermatology. We've learnt how much the mind and your state of mind and your stress and your anxiety can influence skin conditions. So what I want to do as well is refer you to a psychotherapist to help you really process with, however you want to describe it, you know, all the horrible stuff that went on when you were at school and beyond, because I really think it'll help you and your confidence and your self-esteem, and also, I hope, in part, may help with this condition as well.
Yeah, I'd love that. I think that would be really beneficial. Sounds so good. It's like music to my ears right now.
I hope.
Yeah.
I hope it will be, you know. I was going to say, sort of, you know, you'll get your confidence back.
Yeah.
But maybe we should say you'll get confidence.
Yeah, maybe. I've never thought of it like that. I think because I always like coming across confidently to people, I've never thought that inside I actually feel so empty, and it's just, you know, not, well, I don't want to say a facade, you know, but it's nice being happy, you know, it's nice being confident, but maybe I don't actually know what confidence feels like until I'll have it inside as well.
I think you do wear a facade, and that's understandable. It's not a bad thing, it's the way we cope. I sort of saw it on you, you know. And I wonder, for the first time, when you no longer have to wear that, you can be really you. Yeah. That's kind of exciting, isn't it?
It is so exciting.
It's a new
beginning. Actually is, yeah. A new Danielle. I don't know if we need another new Danielle, but yeah.
I want another new Danielle, definitely.
Oh, God.
I never fully understood that Danielle's condition affected her to this extent. It's not every day you get to be seen as a whole person rather than your condition.
Thank you.
All right,
perfect. All right, see ya. I don't think I was expecting for my emotional side to come up today. I sort of assumed, oh yeah, it's a scalp problem. Hey. I'm gonna come in, get a diagnosis for my scalp, and my scalp's gonna be sorted. But it went from scalp to mental health, which is not what I was expecting at all.
You two are so refreshing, you know?
Aw, thank you.
Thank you, so are you.
Thanks, girls.
Girl.
Well, take care.
You too,
Have a good day.
You too.
All right, bye.
After you.
Thank you, girl. I mean, you know, the queen goes first.
Of course, the queen bee.
And a peasant follows.
Oh, shut up.
My biological mother sort of told me never to trust, you know, sort of therapists.
It's one of those conditions that no one has really ever heard of.